Hello, and good day, everybody. Here, if you're in Europe or our region, I should say, it's good afternoon. For those of you across the other side of the Atlantic, good morning. And for people elsewhere, good evening. And welcome to the latest in our series of open online briefings. This comes to you from our organization 4SD, Skills, Systems and Synergies for Sustainable Development. We are providing this service because as a result of my being one of the World Health Organization's special envoys for COVID-19, I have the opportunity to be able to amplify the guidance of the World Health Organization and interpret it in various different settings. And this creating the opportunity for online briefings gives me an opportunity to share with you some of that guidance and some of the challenges and opportunities with implementing it. And at the same time, I'm also very keen to receive feedback from you. We are preparing narratives, and you will have heard about this. They're available on the 4SD website, which is www.4sd.info. And what happens is that as a result of these online briefings, we get quite a lot of suggestions that come in that help us to revise the narratives. And the network of people from our organization 4SD is taking these narratives and seeing whether or not they have relevance in different settings. And I welcome all of you on this call who are part of the 4SD network. Thank you for joining, as well as people from other networks. And my reason for saying that is that given the extraordinary speed with which COVID-19 is spreading across the world, affecting people and institutions and governments and businesses everywhere, it's important, we believe, that we try to keep up to date and we try to be able to move together. And it's through our networks that we're best able to do this. They kind of align with our different organizations and can help us to pivot what we're doing quite quickly. Now, we're recording, by the way, so that if anybody wants to see this afterwards, they're welcome to do so, and we will make that available. And we're just going to start with an update by me over the next 8 minutes or so, which will tell you what I believe is happening. And then I will weave other aspects of the update into any responses I can do to your questions. The questions, you will see instructions in the chat line about the questions. What we do is we receive your questions and comments, and we then pull them together, and you will recognize your question, which will be part of an omnibus answer that I will give as we go through this session. Please do share with us your views on this methodology for sharing. And if you think it's helpful, we'd really like to know. But also, if you think there are things we could do differently, please tell us as well. Thank you very much indeed. Just because we might run out of time, I just want at this stage to acknowledge all the members of the 4SD team who in various different locations are working on this, and in particular Florence Lasbens, who's sitting on my right, who is assembling stuff and is passing it to me. And I'd like to thank Thuy Nguyen, who is currently dealing with the management of this teleconference, and who has set up various systems, because in previous ones, as some of you will know, we had unwelcome guests come and join us, and we tried to create ways to prevent them from doing so. I mentioned before that the real epicenter of the series of outbreaks that make up our COVID-19 pandemic had become much more Europe and North America. And really, this was where the most intense outbreaks are happening, creating an awful lot of illness and leading to health services being flooded with large numbers of people who are ill, but also leading governments to implement a series of measures to try to help bring things under control. And in fact, we are beginning to see from a lot of different indices that the situation for people in Europe is really starting to improve, but very slowly, early signs. And we're still not sure whether or not the improvement is really going to be sustained. And we're also beginning to see some evidence that in some parts of the US, there's also improvement in terms of a reduction in the number of people with severe illness turning up at health services. But unfortunately, the outbreaks are advancing now in other geographies, and particularly in India, where actions have been taken very quickly, but still there is a build-up of people with COVID in different parts of the country. Actions are also advancing in, the outbreak is advancing in Africa. We're looking particularly at South Africa, at East African countries, Kenya and Somalia, at Cote d'Ivoire and other West African countries, Nigeria. And we're also looking at North African countries, Algeria, Egypt, Tunisia. And then we're picking up also news from Latin America, particularly Ecuador and Brazil, of advancing outbreaks there. And then some Middle Eastern countries getting signs there. There's no part of the world that is now able to say that it's free of COVID. And in fact, more than 70 countries, as you know, are taking action of all kinds to try to deal with the challenge. Actually, trying to deal with COVID outbreaks involves one very basic thing, which is to try to interrupt transmission of the virus from person to person. It's a highly infectious virus, and it moves from person to person in the respiratory secretions that are coughed out when you've got the disease, and those within a meter or so are quite likely to get your cough secretions coming and entering into their own respiratory tract, and that leads to the likelihood of infection. And so therefore, actually distancing from other people is key to reducing transmission. And when somebody's got the disease, it's really, really important that they are isolated from other people and that they stay isolated for 14 days. Of course, if they need medical care, they should be got to hospital. If they need any kind of support, they should be given that support. But basically, it is isolation. And the contacts of the cases should also be identified, people they've been in contact with in the preceding few days, and they should be isolated as well. And it's that isolating people with the disease from other people so it can't be transmitted, that is the mainstay of trying to prevent outbreaks from building up. So you move from one person with the disease to a chain of transmission to a cluster. And if you can reach these outbreaks early and you can suppress them quickly in ways that stop transmission of disease while looking after the rights and well-being of the people who have got the infection and who are having to isolate, then you can actually stop outbreaks from forming. And what we've learned from all the countries that have succeeded in getting ahead of the virus is this ability to stop outbreaks forming from interrupting transmission through isolating people with the symptoms of the disease quickly. That is what we have to do. And of course, if an outbreak builds up, which it does stunningly quickly because this is a highly infectious pathogen, then within the space of 2 or 3 weeks, you suddenly find you've got a huge number of people with disease, some of them seriously ill, and then health services get overwhelmed and health workers' lives are endangered because they're being exposed to people with the virus. So it's really important to get this early interruption of transmission and suppression of outbreaks in place in order to protect health workers everywhere. Sometimes people don't fully grasp the importance of being able to interrupt transmission, particularly at the community level, through this identifying people with the disease and isolating them. And people say, well, that's too difficult. What we need to do is to do a lockdown. But a lockdown doesn't actually solve the problem. A lockdown helps to reduce the amount of transmission that can occur because it reduces opportunities for people to transmit the virus one to the other, but it doesn't actually stop the transmission. It doesn't necessarily do this deliberate interruption and then suppression work that needs to be very, very well organized and robust. So our message to everybody is please put in place now, community level capacity to be able to identify people with the disease and isolate them and to trace their contacts and to quarantine or isolate them as well, because that's the secret of dealing with outbreaks and suppressing transmission. And that community organization does mean knowing who is in your neighborhood, knowing who is ill or well, knowing who needs support and help. It's that kind of close personal knowledge through what one might call simple drills, as one of our team says, where you just know who's in your community. Some people say, well, that's infringing upon civil liberties, and I quite understand that. But I want to stress that everybody who has the disease has the potential to infect others. Everybody who has the disease has the potential to lead others to have a really miserable time. So therefore, it really is an important part of individual responsibility, not just for your own health, but for the health of others, that this capacity to identify who's sick and who's well and to do the isolation becomes so important. And it's necessary in all geographies everywhere. It's part of the new normal that we will have to have while this COVID virus is still around, is the ability to detect and isolate. Now, of course, what we've learned in the last few weeks is that the best way to do this detection and isolation is through testing people who've got symptoms. Have you got the virus or not, we ask, and then a nasal swab and then a lab test using PCR, and you find out whether or not they've got the virus. But the problem is that scaling up PCR testing to check for viruses among all the populations in the world is proving to be absolutely impossible. They're quite difficult tests to do, and you really need either very expensive platforms on which to do it if you're going to do high throughput, or some quite sophisticated biochemistry and immunochemistry to do it if you're using it on a smaller scale. And we must not assume that everyone everywhere is going to be able to test all the suspected people for their COVID. If you have got tests, they should be given primarily to health workers or to people with symptoms. So most of the work to isolate and to break chains of transmission has to be done on the basis of symptoms. And several of you will have had COVID, and you will know that the symptoms are pretty well understood. You know, out of 100 people who get the disease, only about 20 out of the 100 get nasty ill, and only a very small percentage are going to unfortunately succumb as a result of that illness. But then the majority, 80 out of the 100, will have the illness quite mildly, some of them very, very mildly indeed. And that's what makes it so difficult to identify people with the disease and get them isolated, because sometimes they only have a very mild illness, a bit of loss of smell, a bit of fever, a bit of a cough, some shortness of breath. And what I'm asking everybody to do is to be super conscious of even mild respiratory illnesses at this time. And even if you can't be tested, to be super responsible and isolate yourself in order to interrupt transmission. Where governments have decided they want to reduce opportunities for transmission by introducing major movement restrictions and also asking people to stay at home, what's sometimes called a lockdown, there are other consequences that have to be dealt with. And we're seeing all over the world that lockdowns are quite confusing for people to cope with. Lockdowns also lead to quite a lot of poverty and discomfort. There are challenges for older people who can't get their shopping or medicines. There are challenges for single parent households because of the multiplicity of tasks that need to be performed. There are challenges for people in the informal economy or small businesses, because SMEs in particular just are in real danger. And so we're trying to all the time work with governments and others to say, okay, you've got a lockdown, but you must have the basic capacity to interrupt transmission in place at community level, even if you haven't got the virus testing, in order that you can, when the lockdown is released, be able to have people going about their business, have businesses restarting and so on, without the need to then reimpose lockdowns because suddenly you've got a huge number of cases coming and they're overwhelming health facilities. And so that double message of put your transmission interruption in place, whilst at the same time keeping the lockdown sufficiently long for the basic services to be built up, but not too long so that it actually leads to widespread impoverishment, and juggling what releasing a lockdown might be like in terms of some parts being released, some parts not being released, some sectors being released, some sectors not being released. That's really important. I want to make a last shout out before I finish my opening remarks. The people who are at the front line of this response are people who are in the health sector. They are health volunteers, they are health workers of various kinds, they are auxiliaries who clean and people who clean the wards, and they are people who are providing all the basic elements for that whole care package that we're offering either at community level, in public health departments or health centres, and in hospitals, to make sure that when the people who are going to hospital get there, they can be looked after with the care and attention they deserve. And you know, most of these people are women. Just as most of our organisation of our lives and our communities is women, it is the health service backbone is almost entirely women, often paid very little for their service, often asked to perform multiple functions as well as providing care, and doing it absolutely brilliantly. This is the year that focuses on nurses and midwives. And yesterday, I think it was yesterday, Tedros gave an announcement from his role as Director General of WHO, just speaking out about the extraordinary contribution for all of our sakes coming from nurses and midwives. And he was profoundly emotional when he said it. I watched him very carefully, and he knows this. He was himself responsible for building an extraordinary health system in Ethiopia. And I think he was absolutely genuine when he said how the whole of society owes an enormous debt to the constant efforts of health professionals, particularly women health professionals. Not all, obviously, nurses are women, but I want to stress that I think it's 74% of the health workforce is women, and they are the ones who are really leading this struggle. And I also want to say that from all we're hearing, it is women working in communities that are providing the backbone of the community response as well. Just you will ask questions, I'm sure, about the change in guidance on masks. You might well ask questions about whether it's true that cats can get COVID and what does this mean. I'll come to that if they're in the questions, because I've run out of my time for my introduction. As you know, I love to talk. So with that, let's just start. Somebody has written a question. I hope you don't mind me not giving the names. Here's the first question. Could you tell us more about your call for a pandemic emergency coordinating council? And do you think the existing WHO emergency committee needs more authority within individual member countries? Well, you know, I worked on this on and off for a few years, and I'd just like to give a very short introduction to the way in which particularly the international system, that's the UN and the World Health Organization, work. You know, all parts of the UN system, including the World Health Organization, which is one of the UN's 22 specialized agencies, these all different organizations work for the good of all the people throughout the world. Within their charters and constitutions, it's always related to we the people we serve. And there's a particular focus on the people who are most in need. But we have to stress that these organizations are not governed by the people. They're governed by the governments of countries that represent their people, and they are the governing body of the UN through the UN General Assembly, of the World Health Organization through the World Health Assembly. And we have to accept that the offices of the UN and the World Health Organization in serving all the people actually respond to and are reporting to the governments of their member nations. And this means that they are very dependent on what the governments of the member nations tell them to do. And they do this through resolutions. And in 2005, a major resolution was developed about a revision of the international health regulations, which set out the responsibilities of the World Health Organization to its member states in relation to health emergencies, and also set out the responsibilities of the member states to the WHO and to each other in the case of health emergencies. And these include disclosure of information. They include the extent to which WHO is able to establish that there is an international health emergency, and also the guidance that WHO can give and whether or not that guidance has any kind of authority to it. And I have to tell you that at the moment in the whole UN system, all the guidance that comes from the international organizations is just that. It's not compulsory. However, What I am proposing, and I think others are beginning to support this, is that it is time for the world's leaders to give greater authority to the Director General of WHO, to the Secretary General of the UN, and now enabling them to work very closely with the big financial institutions of the international system, the International Monetary Fund and the World Bank, and to link with all sorts of other organizations that bring together business, trade unions, civil society, indigenous people, but basically to give them just a little bit more authority for a temporary period, because this is a global emergency, in order to basically study what's happening in different countries, to provide guidance that is very strong, and to identify countries whose actions are deviating from that guidance, whilst at the same time ensuring that the different aspects of the pandemic response, the health aspects, the human aspects, the economic aspects, and the trade aspects, and all else are properly handled in an integrated way between the heads of the major organizations. So it's suggesting that there is a temporary giving of extra authority to these leaders. Actually, I've said for 3 months, in the form of a pandemic emergency coordinating council. I put in emergency because I think it's an emergency. I put in coordination because these agencies are allowed to coordinate, and that's what they're supposed to do. But I suggested that this be done, and this be something that the G20 authorize for a period of 3 months, because I just think that at the moment, given the way in which this pandemic is hurting so many billions of people who are being asked to make huge sacrifices in order to try to help the world get on top of and ahead of this particular virus, that some special arrangement is needed. Well, the idea is floating. I pushed it out in a narrative the weekend, recently, and we're waiting to see how much it's picked up. And I do believe that as the situation advances and as more and more countries end up in part of this epic struggle, that perhaps an agreement, that some kind of arrangement where people can say, okay, we know who's leading. I think that helps, because I think at the moment there's a sense that governments are juggling with multiple challenges, and that also they're only working with a little bit of cooperation with each other. And there are all sorts of problems with essential supplies of masks and gowns and all the rest for health workers, and of essential food supplies and other essential goods stuck at borders because of failure to coordinate between countries, leading to border challenges. There are ships stuck at sea, thousands of them, because of difficulties of what happens on cruise and what are the rules about trade. And there are generally a lot of things that are disconnected globally that I want to see better organized. So that's why I'm asking for it. And I kind of upped my advocacy in the last few days, because I'm really, really more and more convinced it's necessary. Second question, this is another important one coming. What are my recommendations for ministries of health in low resource settings? So what do we mean by low resource settings? We mean a country, for example, like Bangladesh, which does not spend anything like as much on healthcare per person per year as is spent, for example, in the UK or in France, where I am right now. And I mean, I think we have to just be totally honest that there are perhaps many thousand-fold differences in the investment in healthcare in the wealthier nations than in the poorer nations. And it really is important we then also come to terms with the reality that recommendations for what to do about COVID have to vary from country to country. So let me talk to, say, for example, there is somebody here on the call from Bangladesh. Let me talk to you and just give you my thoughts. Now, this is not me talking to any government. This is my saying what I, as a person who knows a bit about public health, would be saying to a minister where I was sitting next to him and we were to be discussing what's got to be done. I would say the basis of dealing with this pandemic is all the time to be identifying outbreaks when they start super quickly. And that does mean being on the alert for people who might have COVID. You don't know that they're necessarily coming in at an airport or at a land border. Actually, there may well be quite a lot of virus inside your communities anyway. So you just will find them, and you may find not just one, but 3 or 4 people, or you may get a report from a district medical officer that there's been about 20 people turning up at a hospital with bad chests, and there's rumors of death in a nearby village. So straight away you're thinking, right, we've got COVID in that place there. We must try, make sure that the people with the disease cannot infect other people. And we must try to track back to make sure that the people who they might have infected can be put in quarantine. Now, you may not have virus testing. You know, we have to recognize that even in Britain, where there's been a huge demand for virus testing, it's not been possible to get tests to people where they need it. So you have to make these judgments even without virus testing. So you do it on the basis of symptoms, these symptoms of COVID. We know that some people won't have symptoms, so you need to be looking for people with very mild symptoms, as well as those who are seriously ill. Don't just concentrate on the seriously ill. Secondly, you need to make sure that they're isolated. And you may have to actually do it yourself to do it. I mean, people don't like being isolated. So it's a lot of dialogue. Try to get them on your side and make sure that they themselves understand the need to be isolated. And isolation means isolation. It means people bringing your food, leaving at your door, and not coming in and being close to you. Or if they do come close, they must be protected as much as possible. You should, if you're sick, you should be wearing a mask, whatever happens. You should, if possible, have water so you can wash your hands and so that others can wash their hands as well. Because the hand hygiene matters because of the links between what is in our saliva and spittle and what goes into our mouths. We're not able to stop touching our faces. And basically recognize that you may not have tests. Now, you also may not have a mask. You know, these nice masks that we need in order to protect ourselves, the N95s, that are very, very good. They're not available very widely. So accepting that no face covering other than a mask really reduces transmission down to 0, you can at least improvise, and you can put some kind of scarf around your face, but using rubber bands. And there are some quite good designs on the internet of ways to do this, using, for example, women's hair bands, which are quite nice and elastic, and you can use them to go round the scarf that you put over your face. Or if you like, you can take a bandana, you could take some other garment and you can put it around. But the important thing is that it must be close fitting and it must be several layers of tissue. And I'm seeing in many, many countries, there is widespread production of masks. And of course, in Bangladesh, the country I'm referring to, there is a whole capacity for sewing, and that could immediately be put over to making masks using multiple layers of gauze or similar cloth. It's just there, as I say, trying to get the design right. Thirdly, you may well not have any kind of health facility. So what do? Well, answer, you take whatever health facility you've got, and you try to make sure that within that health facility, you've established some tents where you can put up emergency beds, and you do what you can to ensure that the patient can be in that bed and that relatives and others are 2 meters away unless they're already been exposed, in which case you can leave them close up. And you've got to make sure that staff are able to keep safe. But what if you haven't got PPE for your staff? Well, again, you have to follow the best principles, which is having a visor, having a mask, having a head cover, having some kind of apron that it covers you completely, having gloves, and ideally it's got to be rubber gloves, but if you can't do that, then it's got to be any kind of glove, but again, with frequent hand washing. It's really, really difficult caring for people if you haven't got PPE, but let's be realistic, there's not PPE in many settings at the moment. And then what do you do if you are worried about running a hospital and you've got people with COVID and people not with COVID? Meet your patients outside the front door. Meet them in a tent with staff who are properly dressed, who are just there to triage and say, right, we think you've got COVID, you go to the COVID side. Right, we think you haven't got COVID, you go to the non-COVID side. And you make sure you separate, because there can be real problems with infection occurring at the place where people come into a health facility. And of course, last point, you really support your health workers. In many, many countries, health workers have not been given the respect they deserve. And I am really disturbed to hear that health workers are in some countries being victimized. I heard this from colleagues in India recently. I want to make one other point, which is that Obviously, it's tempting to impose a lockdown because that is a way of reducing the number of people who have disease. But don't let the lockdown be assumed as the actual control measure. And anyway, it's really difficult for people in poor communities to go under lockdown if they're on daily wages. Myself, I would not be being tough on lockdown in rural areas where I think that people by and large need to be able to get into their fields and do that stuff, but you do want to make sure they do try to keep 2 meters away from each other as much as possible. But I think in urban areas, you have to do it with a lot of respect for people and ask local community leaders to decide how they're going to do it, but in making sure that they understand that it's actually through movement that the disease spreads. I hope that's some help. We are trying to develop a narrative on this, and one of my colleagues has been working really hard. It's really tricky to find the right way to recommend what are really important instructions of the world so that they're adapted to low-income settings, because you don't want to give anybody an excuse for not taking the precautions seriously. So I'm working very hard with my colleagues in WHO every day on actually helping all the time to adjust guidance, especially somebody like me who worked for quite a lot of time in very minimally equipped health centres around the world. I am very conscious of just how tricky it is for health workers everywhere. Now, question 3. Some people are relying on the message that COVID-19 is similar to flu. And that means that they're taking it quite easily, because with flu, we do tend to say, well, the flu is going to come and affect all of us, and we might just as well get used to it. So perhaps we should just let it happen. COVID-19 is not a flu virus. It's a coronavirus, and it's a different kind of virus. It forms major and very nasty inflammation in the upper part of the lungs, which can, in certain people, under certain conditions, go further down into the lower part of the lungs. I'm pointing here to the lower part of my lungs. It can infect the alveoli, and when it gets into the alveoli, it thickens the alveolar wall with inflammation, and breathing gets very difficult, and the level of oxygen in your blood falls, sometimes very rapidly. Your lungs get stiff. You may need to have a lot of oxygen and even mechanical ventilation to keep yourself alive. This is a vicious, vicious virus. It's not a virus that we should in any way assume is easy. Any leader who says, oh, it's just like the flu, don't worry, you know, they haven't heard about this coronavirus and seen what it's done to communities in northern Italy, what it's done to communities in Spain, what it's done to communities in Iran, what it's done to communities in other parts of the world. It is unforgiving. And if you don't take it seriously, it comes up and it surprises you. So we really need to say to everybody, 1, don't confuse the virus with the flu virus. 2, don't confuse your response to the COVID pandemic with the response you have to a flu pandemic. This pandemic is here and it's going to stay. And as far as we can see now, it doesn't look as though it's going to be softer on poor countries. It may be a bit softer, but still we're getting death reports through from India and Africa right now, and Latin America right now, which show that it is causing trouble in poor countries. And in all respects, don't start assuming that there will be some nice herd immunity that will protect us all. There are data coming from South Korea today that suggests that people who've had COVID are getting it a second time. We don't know whether this is because of some peculiarity with the early testing. We don't know, therefore, whether we can't explain it. Like everything about this COVID, it's new and we're learning about it. And as my colleague Bruce Aylward at WHO says, don't underestimate this virus. Don't assume that just because there are certain patterns we've adopted for flu pandemics, they apply to COVID. So what can you say, this says the questioner, to dispel the confusion between COVID and flu? Answer, tell them that David, Special Envoy for WHO, says, do not imagine that this COVID pandemic needs to be treated in the way a flu pandemic is treated. It's a new virus. We're learning about it every day. We've never had a coronavirus pandemic before. So we have to learn while doing. And that's what we'll do. So somebody asked question 4. Hello all. Sorry if I'm going on too long and talking too fast. Time for me to slow down a bit, perhaps, at 17:35. And one of the things I'm learning to do with the importance of stopping and breathing for a couple of seconds. So I'm just going to take a quick deep breath in. And then I start with question 4. How do we get safely out of lockdown? So yeah, more than 1/3 of the world is living in conditions of lockdown. And an awful lot of people are saying, when will it end? Will it ever end? Yes. Will it end soon? I don't know. Can you give me some clues as to whether it might end soon? Yes, I can. So I start with what needs to be in place for lockdown to be lifted. Most importantly, everybody in society needs to be aware that this coronavirus is going to stick around for the foreseeable future. It's not going to just disappear. It's a new fact of life. If it does suddenly disappear, we will all give thanks and say, phew, relief. But at the moment, it's just here. And although we've got a lot of big outbreaks happening at the moment, and we think, wow, can we get through these outbreaks and say it's done? That's not how it's going to be. We're going to have to be living with this virus for the foreseeable future. It's going to be stalking our communities. It's going to be there. I'm going to use military metaphors for a bit. I don't do it very often, but this might help. Basically, this virus is an unseen enemy, but it's an enemy that only manifests itself when it gets inside people and it takes them over. And they become the carriers of this unseen enemy in enormous quantities inside their bodies. And so in order to understand where this enemy is, we have to find the people who are carrying the virus. And they're not to be blamed for carrying the virus. We have to be super careful. This is not something for which there's any blame. I've always hated blaming people with disease, but it's always gone on through the years. But this time, let's be clear that these people are not to blame. They just are the carriers of the virus, and it's really unfortunate for them. And we have to help them. And the most important thing we have to help them to do is to keep themselves isolated and to keep well. We help them to keep isolated by checking that they know they've got the disease. We don't have to test them because we're not going to have a test. And so we've got to be able to do it on the basis of what we're seeing and what we're hearing, or what they're telling us on their cell phone when they send a message. Hey, Dad, I don't feel well. I've lost my sense of smell and I got a fever and I feel rotten. You've got COVID. You know, that's what we've got to do. We've got to be able to deal with it on presumptive diagnosis. And then we've got to ask them to isolate and make sure they isolate and take it really seriously. And if they can isolate from other members of their family, brilliant. We heard from somebody recently who did it without telling other members of her family, but she just did it because she felt that she was at risk and she didn't want to endanger them, but she also didn't want them to be worried. And then we've got to have that capacity in all communities to be able to detect people and to isolate them, or to help them to isolate, to look after the old, to make sure the hospitals are working. All that capacity has to be put in place. COVID-19 ready, I call it. And it's about being defended. And it's about making sure our health workers have the shields that they need to defend themselves, the necessary gear. And it's about making sure that we've got masks if we decide we want to use them, so that we can keep healthy in case there are asymptomatic people around. And once we've got that happening, and once it's there in all communities, then quite honestly, we can leave the lockdown, because we'll be able to deal with the outbreaks where they happen and stop them quickly before they get bad. And I wish that every country, every community that's going through lockdown was spending all their time and effort establishing a sort of honeycomb inside the community where they get COVID ready and they set up their defenses and they make sure those defenses are working through doing simple drills and then knowing who is it I contact if there is somebody with COVID symptoms in my community. Well, that should be known to everybody. What's done if that person gets seriously ill? That should be known to everybody. What do we do if we find that there is a great cluster of people coming up and really ill and we don't know how to manage it? We should know who to call on from the Public Health Administration. What do we do if people are saying, well, we don't want to isolate, we don't see why we should? Then there has to be a dialogue, and they may have to bring on board people from the police. And that the police are learning how to deal with these kinds of situations, to diffuse tensions. It doesn't have to end up in a riot. And we've got so many examples coming through from members of our network saying, actually, the police are becoming the role models for how to do it, because they realize that if they can get it right and they can get communities to do it right, that keeps the whole of society safe. That's what coming out of lockdown is about. That strength and robustness, solidarity at the community level for really good, rigorous action. Thank you for that one. Now, question 5. What are some examples of the most impressive community leaders that you have encountered, and how can we keep them motivated? I think all of us are hearing about people who are just doing extraordinary efforts to establish the kind of community-based leadership for local rigor that I've just been talking about. In our team in 4SD, 3 weeks ago, that's right, we tried to tap into some of the experiences we were hearing about. And that's how we developed narrative number 6, which is a PowerPoint narrative as well, about having local rigor at the community level with solidarity and making sure that you have sentinels who know what's going on among their people, and then having networks of support that are backing them up, and then having coordination capacity. And we were getting it from a few people, but since we did this, others have been contacting us and saying, hang on, David, we've got lots to tell you. We know about what community action is really about. So hearing about in Somalia, phone-ins where people can just simply talk to other people about what they're thinking and hearing. They can express their view that this is all some government plot to keep them under surveillance, or they can express their concern that this is all being introduced as a result of some terrible biological warfare accident. Or they can talk to each other about what does it really mean to be in lockdown? What's this really doing? And how do we cope in society? How do we get food or milk, or especially as we haven't got any cash? And what I found out was listening to my colleague who wrote about this from Somalia was the phone-in has become the kind of modern day equivalent of a village meeting, because we are all supposed to be social distancing and we're not allowed to gather. So how do we actually come together as a community? Answer, through things like phone-ins, through things like WhatsApp groups, through things like what we're doing here with Zoom. And I do actually want to say that I am learning that in all communities everywhere, there is this capacity coming together of people just connecting and having the dialogue that's absolutely essential to work through these issues. And then over time, there's a sort of recognition, okay, yeah, this is a horrible threat, but we're capable of getting through this. We've done other threats before. We've done threats to our individual person, to our community. And that rule of if you work together, you do much better than you work separately is really coming out. So here's a colleague from Kenya, near Machakos, who's been in one of our immersions in 4SD, who contacted Florence and said, you know, what we actually went through a system when we had the terrorist outrage in Westgate Shopping Centre in Nairobi, not very long ago, 2 years ago. And I've forgotten the name of what it is, and I've just got to look it up. It's the 10 households thing, 10 neighbours. Anyway, what she told us was that after those terrorist attacks, the government suggested that every person should know their neighbours, 10 to the left and 10 to the right. So basically to understand who was in the community and just get connected to them and check up on them and be in regular contact so that if anything strange was happening, they picked it up. Well, that same method is incredibly useful. That simple drill of knowing what's going on in your neighborhood, so important. And this colleague was explaining how that was done and how that's proved to be so useful, but just keeping a check on who's sick and who's well. And then hearing also from her about the way in which communities have realized that not much money in their pockets, they've got to try to stretch it as far as possible. And they're working with each other to try to pool assets in order to make sure that the money goes as far as possible. And then caring for those who are disabled or who can't just get around because they're old. How can we keep motivated? Answer, keep sharing the stories. Keep reminding ourselves that this pandemic will be overcome and we will learn to live with the constant threat of COVID-19 through our capacity to work as communities, because that's where the action is. It's governments are there to help, to offer guidance, to give us facilities, to help us out because some of us, not me, are going to get super poor. But it's actually up to us. And our health facilities are our facilities, our health workers from our communities. So let's support them so they work. Let's actually try to find ways to strengthen them, because actually our health facilities become the center of our safety and our security. And our health workers, as I said before, are the people who are going to lead us there. So as communities, as part of this work, and what I'm hearing more and more is fabulous things being done to support health workers. So a colleague of ours working again in Africa, but in Eastern DRC, linking up with a nearby doctor who wants help to get hold of masks and using his whole network to enable them to get the masks they need. And then hearing from my colleague who works for a farmers organization in India, working out where the food insecurity problems really are, and then talking to the government about ways of getting cash to the people who are the most in need, and building onto an existing program of supporting the landless laborers to ensure that they can get an extra handout of cash, because food for them is not useful because they can't cook it. They're all stuck, not able to get home in many cases, not able to get the firewood and other fuel that they need. And so actually finding ways that communities are able to cook food for them. And I'm hearing numerous examples throughout India of people setting up kitchens and enabling poor laborers and others to come and get food, but doing it against social distancing. What I love is seeing how people adapt using the guidance that's received from, departments of health, but adapt to their local reality and create their solutions at community level. That's really creating the structure and the honeycomb of societies needed for the future. And I think those of us in 4SD watching this happening are just saying, wow, let's all recognize that this is the pattern that is going to be needed for more and more things in the future. Let's take advantage of the emergence of this solidarity and the capacity of networks to support that solidarity. I know it's not easy. Question 7. Do I see that concentrating on the virus is going to have an impact on the availability of essential medicines? And do you see that there will be a wider ease in the availability of medical abortion, as has happened already in some countries? A wider ease. I just want to check what that might mean. Does that mean increased access to medical abortion or decreased access to medical abortion? I'll come back to that. So, is concentrating on the virus going to have an impact on the availability of essential medicines? I think that the pandemic as a whole and responses to the pandemic are impacting on the transportation of things that have to go within countries across long distances and between countries across borders, that all these supply lines are being interrupted. And we have heard that, for example, paracetamol supplies in some countries are being interrupted because they are being kept for use in some places. We've heard that supplies of a number of medicines that are nothing to do with COVID are being interrupted because of the general dislocation of supply lines. So I think we must expect that certain medical goods are not going to be easily available. And I can quite understand that access to contraception might be decreasing. I have heard that access to condoms, particular form of contraception, obviously, and protection as well, that is reduced because of the close down of some condom factories in Malaysia, which may lead to some difficulty. It depends on the stockpiles. But I think there are going to be challenges to supplies of a lot of essential goods. I also want to say that a number of health programs that are nothing to do with COVID, for example, for family planning, for example, for and reproductive health, for example, for malaria, are being disturbed as a result of COVID. I've also heard that access to essential services like termination are also being interrupted. And so I think that we need to keep a lookout to make sure that the services that people are used to and that they need are not being interrupted as a result of COVID, and do what we can to maintain those, whether they're immunization for children, reproductive health for women, or services for trauma and other issues for all people who have accidents, or treatment for chronic ailments like high blood pressure or diabetes that we all need. And so let's just try to keep working on that. And I don't have a solution for it, but I know that it's an issue. And my colleague Tedros, now I'm going to speed up. What can WHO do to help countries like Spain, where more than 40% of cases are health professionals who've been sent to fight this virus with inappropriate protection? Answer, really call it out. No health worker, especially in an industrialized country, should be having to fight this infection without adequate protection. We need to do everything possible to deal with the market failure on access to PPE, and we need to also discourage the stockpiling of PPE by hospitals or governments that are just simply holding on to it because they know there's a shortage, and that is something on which I'm working super hard. Question 10. The messaging does not say anything about nutrition. With poor nutrition, our communities at risk of severe disease because of compromised immune systems. So I want to say very clearly that we believe, but we don't know for sure, that when somebody is immunocompromised, they get COVID worse. I say we don't know for sure because the way in which the virus interacts with the body and the pattern of immune response is still a little bit misunderstood. But my basic line is, and I have been saying this, but I need to say it more, is that people do need to be adequately nourished in order to be able to fight this. Both they need to be adequately nourished for their own physical well-being, but also for their mental and emotional well-being. Question 12, how soon will we know if antivirals will work? There is a trial underway, the Solidarity trial. It's been coordinated by WHO in multiple settings, looking at a number of antivirals to see if they're effective. I can't tell you when we will know the results. The design is one of those ones where you will see the results quickly. You don't have to wait till the end of the trial and then undo any randomization. So I can't tell you for certain, but I know it's underway. And if you look for the Solidarity trial on the WHO website, that will give you more information. Next question. Some countries have required all citizens to wear masks in public. Others have recommended it, but WHO has not recommended masks for healthy people. What would be the harm of using masks in public along with other necessary precautions? There is new WHO guidance on masks. It's out today. I saw it and I looked at it very carefully. The situation is as follows. There's a global shortage of good masks, N95. And so the people who should be prioritized for those masks are 1, health workers, 2, people who are sick, 3, those who care for people who are sick. We should not, all of us, be using these vital masks because there's a shortage and that be taking them away from those who need. But I do think, and all of us think, that there is value because of the possibility of asymptomatic transmission of HIV, that as we move towards the state that we will all be living in, once the present phase of outbreaks have come down and once the lockdowns have stopped, we should be ready for all of us to be wearing some form of mouth protection. But I just want to be clear that we're here dealing with the edge of what's important. What really matters the most is health workers and people who are sick. Next question. Other hardships like natural disasters will keep occurring. Absolutely. There's a big tropical storm happening in one Pacific island right now. So what is your advice for places like the south of the US and the Pacific Islands that are going into the hurricane season? Absolutely. Thank you for saying that. The same resilience that we need for dealing with COVID is the resilience that we need to be strong in the face of these. The world hasn't stopped because of COVID. And I'm really, really pleased that you've mentioned that point. Thank you for bringing it up. Question 13. How can development partners come together with governments to revisit resource availability and regroup to address the pandemic. It starts with the G20, the rich countries of the world, and particularly the big central banks. They've got to come together. They've got to make sure that whatever money is needed to properly fight this pandemic, whatever money is needed to equip health workers, whatever money is needed to make sure that public health services are COVID ready, whatever money is needed to make sure that small and medium enterprises don't go completely bust and then there's not a vast increase in poverty, that money is on the table. It's no good them just saying, well, we'll come up with 1 billion, 5 billion, 8 billion. No, it's not a blank check. It's just saying we will make the money available. And then there's got to be some kind of mechanism where this pandemic council can actually work out what money is needed where to deal with the supply failures, to deal with the liquidity problems in poor countries, and to make sure that the resources are there. And yes, there will be a challenge, but if we can't get the pandemic properly dealt with, the need for lockdowns will continue. If lockdowns go on happening, the global economy, and particularly the economy of poor countries, is going to be shattered. So the priority is to deal with the pandemic and to deal with it properly. And that means getting health systems properly sorted out. For me, the logic is clear. It's not public health or the economy. It's not money for public health or money for economic revitalization. It's doing both, but putting the priority on the pandemic first. And it's really putting the priority on getting basic public health sorted out. My last question, everybody. Hope this has been helpful. Very nice to see you all on. I can't take my eye away from the camera and look to see who's on, so I can't see whose names are there, but thank you all for being with us. And I hope that this is useful. I hope your feedback. And I come to my last question. What can be done about the increase in food prices recorded in some countries? If only there was a magic solution. What happens in any crisis is people hold on to what they've got. Individuals hold on to what they've got. Communities hold on to what they've got. Local authorities hold on to what they've got. Governments hold on to what they've got. And then regions hold on to what they've got. And that practice of withholding, which is a natural response, leads to a scarcity. That scarcity leads to price rises. These price rises happen at local level, and the people who are hurt the most are the people who are on daily wages, who are really, really short of cash. You can't conquer this simply by saying to governments, so by governments saying to everybody, you may not rise your prices. Not in most countries. It just doesn't work. I know that governments are trying, but it tends not to work. I mean, I would like to try to encourage all governments to communicate right throughout their countries saying, if you go on hoarding, we will be in trouble. So for me, it's got to be doing everything we can to get cash into the hands of people who are very poor, because we can't stop the prices rising, but we can help people who are poor to get the food they need. And then in due course, if some kind of global arrangement was possible, we might be able to get more of a global pact on how to reduce prices. Here in 4SD, the team of, I'd just like to say their names and I'll try and get them right and make sure that I don't leave anybody out this time, of Florence, of John, of Twee, of Joe, and of Julian, and of Catherine, and all of us with Magali and Saber. We have come together and we're working as hard as we can to try to make certain that we can continue to support the World Health Organization in amplifying their guidance. But most importantly, we can interpret their guidance for people who are trying very hard in many different settings to deal with this pandemic and to maintain their well-being and their economies. We're trying to ensure that through this work, communities are enriched and empowered so that they're not only better able to deal with this health threat, but they can deal with other health challenges by being and working as a collective. We're also trying to make sure that the solidarity helps us deal with the many other major challenges that beset us: migration, biodiversity loss, climate change, and many, many more. You, individually and collectively, are all connected to networks. You are active in communities. You are coordinating very, very widely. We are delighted to be connected with you. We'd like to continue connecting with you. We'd like to receive your experiences. We'd like to receive any comments you've got on how we can be better. And with that, with thanks to our marvelous team, but to you also for being with us, I say thank you. Thank you so much. And thank you for all you're doing. Bye-bye.